Good day, my name is Glenda Lindangan, a first-year nursing student at Central Mindanao University. So in this video, I will be demonstrating the procedures on assisting a client to ambulate. So let's start. So prior to performing the procedure, introduce self and verify the client's identity using the agency protocol. So good morning, sir. My name is Glenda Lindangan. I will be your nurse for today. So what's your pangalan, sir?
Michael Bukas.
Kano sa yung birthday, sir?
November 28, 2001.
Okay, so we already identified the correct patient. So we have to do that in order to make sure that we are giving the intervention to the correct patient. So the next thing that we have to do is we have to explain to the client how we are going to assist him, why ambulation is necessary, and how he or she can participate. So we also have to discuss how this activity relates to the overall plan of care. So stress that the client must keep the nurse informed as to how the activity is being tolerated as it progresses. So for today, sir, I will assisting you to ambulate, sir. It means kanang tabangan pa ka, sir, na mag-try tawag lakaw, sir. So it is important, sir, para ma-practice na inyong body o kanang lakaw-lakaw, sir. So since pila naman kaka-days nga gihigda lang. So okay lang, sir? Sa mga? Okay, thank you, sir. So we have to do that in order to make our client understand the procedure that we are going to do, and it will also help us to gain his cooperation and his trust. So let's proceed to the next step. So the next step is we have to perform hand hygiene and observe appropriate infection prevention procedures. So for the hand hygiene, I will use this alcohol-based hand rub to prevent the spread of microorganisms. So I just have to rub it until it's dry. Okay, let's proceed. So the third step that we have to do is we have to ensure that the client is appropriately dressed to walk and has shoes or slippers with non-skid sole. So we already prepared his slipper right here on the floor. So let's proceed to the next part. So the next step is to prepare the client for ambulation. Have the client sit up in bed for at least 1 minute prior to preparing to dangle his legs. So we have to give him 1 minute before we proceed to the next step in order to, if ever he will feel dizziness or any lightheadedness, 1 minute will be enough for his body to recover. So sir, tabangan ta ka, sir, ha, na magsita, sir. Kaya mo na itong first na nabuhatan para maka-ambulate ka, sir. So in the count of 3, sir, tabangan ta ka bang, sir, ha. In 1, 2, 3. Okay lang ka, sir? Comfortable na ka? Okay lang, sir? Okay lang, sir? So the next step that we have to do is we have to assist the client to sit on the edge of the bed and allow dangling for at least 1 minute. So sir, akong iipot ang imong tiil dire sa edge sa bed, sir, ha? Tawag ka, sir, ha? In 1, 2, 3. Sige. Oh, sibol na kami, sir. Okay? So, magtapura ka ang inyong position, sir. Okay, good. So now let us proceed to the next step. So we have to assess the client carefully for signs and symptoms of orthostatic hypotension, for example, dizziness, lightheadedness, or a sudden increase in heart rate prior to leaving the bedside. So that will allow for gradual adjustment because that can minimize drops in blood pressure and fainting that occur with shifts in position from lying to sitting and sitting to standing. So sir, sa pagbangon niyo, sir, did you feel any dizziness? Nalipong ka, sir? Or sa man naman na-feel, sir? Okay lang, sir? Wala ka kang lipong? Okay, good. Thank you, sir. Now, let's proceed since our client doesn't feel any dizziness while nagbang siya. Now, let's proceed to the next step. So, the next step is to carefully attend to any IV tubing, catheters, or drainage bags. So keep urinary drainage bags below level of the client's bladder. So that will prevent the blood flow of urine into bladder and risk for infection. So if the client is a high safety risk, example, cannot follow commands, medical instability, lack of experience with assistive device, or has neurologic deficits, we have to use a lift with ambulation sling and 1 to 2 caregivers. So we also have to note that if the client is a high safety risk and has upper extremity strength and is able to grasp with at least one hand, use a lift with ambulation sling or a 6-stand lift with ambulation capability and 1 to 2 caregivers. While if the client is a low safety risk, example he is able to follow commands, medically stable and experienced with assistive device, use a gait transfer belt for standby, assist as needed and assistive devices as needed. So, for example, crutches, walker, or canes, and 1 to 2 caregivers. So make sure the belt is pulled snugly around the client's waist and fastened securely. So we have to grasp the belt at the client's back and walk behind slightly to one side of the client. So the next step that we have to do is we have to ensure client safety while assisting the client to ambulate. So encourage the client to ambulate independently if he is able, but we have to walk beside the client's weak side if appropriate. If the client has a lightweight IV pole because of infusing fluids, he may find that holding onto the pole while ambulating helps with balance. So if the pole or other equipment is cumbersome in any way, the nurse must push it to match the client's face, securing any assistance necessary in order to move smoothly with the client. Sige sir, iato sa isuot na niyo paano mo sir, slipper. Okay. So, ito sa ka sir. Okay sir ha, and 1, 2, 3. Okay. So, okay ka sir? Wala ka kanalik mo sir sa ibang pagtulog? Okay, so, ako kang i-assist sir ha sa inyong pag lakaw-lakaw. So, mag-first ka sir, painom ta dito, tapos balik ta dito sir. Kaya lang sir, assist lang ta ka sir ha. So, if ever sir, makafeel ka any pain, ignaradate ko sir ha, or malipong baka na sir. So, we have to remain physically close to the client in case assistance is needed at any point. So, we have to do that in order to make sure that our client will be secured and he will be safety while we are doing the procedure. Sige sir, try na to og lakaw daw paingon dito sir. Sige daw. Hinay lang sir. Hinay na. Okay, so paingon daw ta dito nga side sir. Careful lang. So if it is the client's first time out of the bed following surgery, injury, or an extended period of immobility, or if the client is weak or unstable, have an assistant follow you and the client with a wheelchair in the event that it is needed quickly. So the next step that we have to do is we have to encourage the client to assume a normal walking stance and gait as much as possible. Ask the client to straighten the back and raise the head so that the eyes are looking forward in a normal horizontal plane. So clients who are unsure of their ability to ambulate tend to look down at their feet, which makes them more likely to fall. So sir, kanang ato lang straight ba na ito itong likod sir? Straight lang sir. Tapos, sir, tama na sir, chin up lang sir, ay, please sir. So, try na to balik og lakaw sir. Ha, try na to balik og lakaw sir. Okay. So the next step we have to do is we have to protect the client who begins to fall while ambulating. So if a client begins to experience the signs and symptoms of orthostatic hypotension or extreme weakness, quickly assist the client into a nearby wheelchair or other chair and help the client to lower the head between the knees and stay with the client. So in that sir kanang unsa may na-feel mo sir? Nalipong ka sir? Okay, so nalipong ka sir? Okay, since our client is feeling dizzy while we are doing the procedure, so we have to stay with our client and we will help him to sit at a chair. So let us use this bed to sit. Sige sir, nilagdagin ko sir. Okay, so if a chair is not close by, assist the client to a horizontal position on the floor before fainting, of course. Assume a broad stance with one foot in front of the other. So bring the client backward so that your body supports the person. Allow the client to slide down your leg and lower the person gently to the floor, making sure that the client's head does not hit any objects. So since our client is just nearby the bed while we are ambulating, so we can also utilize the bed for him to sit down, for him to recover the dizziness that he is feeling while he is ambulating. So that's the end of the procedure. Thank you for watching. And now let's proceed with the variation. We have to ambulate the client with 2 nurses. Let's start. So the first step that we have to do is we have to place a transfer belt around the client's waist. So each nurse grasps the side handle with the near hand in the lower aspect of the client's arm with the other hand. So, tindog lang sa sir. Ipanakan na sir ha. And 1, 2, 3. Okay? So, I will be putting this transfer belt. Okay, so the next step that we have to do is we have to walk in unison with the client using a smooth, even gait at the same speed with the steps, the same size at the clients. So, sige sir, so nurse. Okay. Sige. Nahinin ang tawag-lakaw sir ha. Now I will be removing this. After ambulating, I will be removing this transfer belt. And now we can now proceed to the last step, which is to document distance and duration of ambulation and assistive devices if used in the client record using forms or checklists supplemented by narrative notes when appropriate. So that's the end of this procedure.